to see you. It's fun greeting you. Here we are.
Okay, so we will open the phone line so that you can get to calling. I don't know if they are opened yet, but we will open the phone lines so that you call in and ask all the questions you want. And you know, as usual, I love stories. I tell stories all the time. So you call in and tell us whatever story you want, okay, about what we are talking about. We are talking about infertility with Dr. from Sefogah. So call in, okay. And then now with the men, what are some of the solutions?
Yes, so just before we come to the men,
okay,
the women who have the tubal problem,
right?
Okay, sometimes the tubes are just clogged with a bit of, call it dirt, debris, okay? And so because these tubes are very tiny, okay, the inner opening is just like the inner tube in the pen. So we may, once we've realized that there's some blockage, there's just some minor procedures we do to kind of flush them open.
To flush, okay. Is that what they call blowing the tube?
They call it all sorts of things.
Okay.
Blowing the tube, washing the womb, da 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 da.
Okay, we have a caller. Hello.
Yes.
Good morning, sir.
Good morning. I am calling from Madam.
Okay, what's your name, please?
My name is Oshri Kwabena Israel.
Yes, please. Okay, please go ahead with your question.
Yes, I want to ask the doctor, for men, during the sex intercourse, you can see that they release.
Can you please lower the volume of your set?
You say?
Please lower the volume of your set, or if you can turn it off, it will be great.
Hello?
Please lower the volume of your set, or turn it completely down, because it's giving us feedback here. Okay.
Okay. Now.
Okay, Kwabena, we lost you because your sound was too high. Please lower the volume. You can't want to hear yourself in the TV, okay? Lower the volume of your set. That goes to everyone who will call. Please lower it. Yeah. Okay.
So, but I get a sense he's trying to talk about some scenario where the women complain that after sex, they see the semen come out.
Come out.
Yeah. Yeah. I suspect that's where he was heading.
Let's hold on to that. We have another caller. Hello.
Yeah, hello. Good morning.
Good morning, sir. Your name and where you're calling from, please.
Yeah, my name is Eric. I'm calling from Mashana.
Okay, Eric, please go ahead.
Yeah, what I need is the contact of the doctor. That's why I've got me talking on TV. So many issues, you know.
Okay. So Eric, please keep watching. At the end of the show, the contact will be given out. Okay.
Oh, okay. Yeah, thank you.
All right.
Much.
Thank you so much for calling. Okay.
Good. So, if I got him right, it's normal that sometimes you see the sperms are living things carried in a fluid medium.
Right.
Okay, so during sex, when the sperm is released here, the living cells would swim up. Some of the fluid after some time would trickle out.
Trickle out, yes.
Unless there is a problem with infertility, if you see your seminal fluid coming out, it's no problem.
It's no problem. Hello, Eugenia. Hello.
Yeah, hello.
Good morning.
Morning.
Okay, where are you calling from, please?
Yeah, please, I'm calling from Amasaman.
Okay, please go ahead.
The doctor was talking about polycystic ovarian cyst.
Yes, please.
Okay, and I went to the doctor. The doctor gave me Clomid, okay, for me to take on my second day of my cycle.
Right.
I took it. The doctor also gave me some time to have sex, but I was having vaginal dryness. So I called the doctor and he said I should buy pre-seed lubricant.
Okay.
So I used the lubricant and I was having irritation. And that month I didn't get pregnant, so I don't know if it's from the lubricant or what. But so the following month I stopped using the lubricant. Okay, but so I didn't get pregnant, and I don't know. Maybe if the doctor can also give me the number so that I can.
You can give him. Okay, so you don't want him to give you an answer now. You want to talk to him afterwards.
I also want the answer.
Okay, all right. So hold on. Okay, don't hang up yet, so that he talks to you directly.
Okay.
Okay, so
right, good. Yes. So I understand the issue. Sometimes in some women, the Clomid causes a bit of the vaginal dryness. Not in everybody. But once there is adequate ovulation, it is not a big deal. Of course, a few women would experience that. and so we recommend the use of the lubricant in those cases. But the fact that you did not get pregnant at that time would not mean because it has to do with the use of the lubricant. What happens sometimes is the clomid is supposed to make you ovulate, but not everybody who ovulates get pregnant. I don't know if your partner's sperm was also checked, okay? Assuming it was checked and then it was normal and you also took the clomid, there is some chance of getting pregnant. There is some chance that you may not get pregnant just taking it once. So we know that if a woman takes it consistently for up to 6 months, there is about 60-70% of getting pregnant.
Okay.
So you need to be patient. If it doesn't work the first time, you take it again, or then we have to see has the sperm become problematic. That would also need something to correct before we do it again. But definitely there is a way to get you sorted.
Okay. I don't know if she's still on or she hung up here. Okay, so we have another caller. But before, okay, let's take the call in and I'll ask you something.
Right.
Hello.
Hello.
Good morning, sir.
Morning.
What's your name and where you're calling from, please?
My name is Joe.
Okay, Joe.
I'm calling from Tema.
Please.
I want to ask whether continuous masturbation can also have a effect on man's ability to.
Oh, okay. I think he was talking about masturbation. He said continuous masturbation.
Right. Whether it can also have an
Effect on infertility.
Yeah. The issue about masturbation is that there's a psychological aspect.
Right.
And then there's so psychologically the man is so used to masturbation that during the time the woman or the partner is ovulating, he's rather not available.
He's not ready. Okay.
To have sex with a woman in order for her to conceive.
Okay.
They prefer to masturbate. So they tend to miss that window of ovulation. Which is very crucial.
Right.
Secondly, as you masturbate and you ejaculate, they release the sperm. You are wasting the sperm.
Yeah.
Yes. So the sperm is not available for when your wife's eggs are ready. So those are the downsides of the masturbation. And that's how it can contribute to delay conception.
Okay. Hello, good morning.
Good morning.
Yes, please, your name and where you're calling from, please.
Elizabeth from Ashaman.
Yes, please. Please go ahead.
Please, I want to find out. I've been having my menses like every month.
Okay.
Every month, as by it is 28 days. Is it normal? Is it okay?
Okay. So you'll be answered, okay, Elizabeth. Thank you for your question. Yeah, I'm sure she
Yes,
will.
so Elizabeth, if you have your menses once a month and it's every 28 days, that is normal.
That's very normal.
Yes, it's very normal. So nothing to worry about. Of course, if you're trying to get pregnant and every month, instead of saying I've missed my period, the period keeps coming, then there is an issue we need to investigate, find what the cause is, and we'll deal with it for you.
Okay. All right. I wanted to ask about the clomid.
Right.
Clomid makes it boosts fertility. Oh, we have another caller. Hello.
Hello.
Hello, Joanna.
Yes.
Yes, my producer was singing with your name. Joanna.
Yes.
Yeah, where are you calling from, please? Anyway, Joanna.
Calling from Kobinya.
All right, please go ahead.
Okay, so I wanted I went to the hospital. But before then, I have tried.
Joanna, we can barely hear you. Can you please speak up a little bit?
I'm saying that
Yes.
before I went, anytime I'm happy with my partner, my place was very dry. Okay, so when I went and I was diagnosed of the PCOS, I thought it was, I want to know whether it's because of PCOS that I have the dryness at my private part, because it's still there. I don't know whether it's because of that I have dry place.
Okay. All right, so Joanna, we got your question. Doctor will answer you shortly, okay? Thank you for your question. All right.
Yeah, so vaginal dryness may not necessarily be related to the PCOS.
Right.
Yeah, there are some people in whom the hormonal interplay is a little defective, and so sometimes psychological, other times in fact, in a few times, apart from the dryness, they feel the irritation.
Irritation, okay.
And that may even be from some infection. So if it keeps coming repeatedly, you need to get seen by a gynecologist, and then we can figure out what is the cause in your case, and then we'll deal with it.
We'll deal with it.
Yeah.
I was asking about the Clomid. It's supposed to be to boost fertility?
Yes, it's one of the medications we use.
Hello.
Each time I ask about the Clomid, we
No
get a
problem.
caller. Hello.
Hello.
Good morning. What's your name and where are you calling from, please?
Hello.
Hello, I can hear you.
Yeah, I'm Victoria, calling from Victoria.
Okay, please go on.
Yeah, my problem is I had my menses that was the January 25th.
Okay.
Hello.
Yes, please go on.
Yeah. So even with that, like I was there and then I started bleeding. I don't know whether I was pregnant by then or not. So it was when I got to the hospital and I was told I was pregnant. Since then, I've not had my menses till now. And as I said, like there's nothing like any kind of pregnancy or anything. Because I saw abdominal pain.
Okay. I think the doctor has a fair idea about what you're talking about.
Yes.
Okay, so thank you for your question. And she was saying.
Yeah, she said she had a period and then she was bleeding abnormally. She was
Yeah.
tested and said it was pregnancy, and then
So she lost the baby. Is that what it means?
okay. So I don't know what test was done.
Okay.
Okay. Now, ordinarily, if it's the urine test,
Right.
sometimes if there is bleeding, and you take the urine and the blood contaminate the urine,
Okay.
it can give a false positive.
Okay.
That happens sometimes. But sometimes, if the woman is actually positive, pregnant, and with that bleeding in the early pregnancy, it could be that the pregnancy is miscarrying or has miscarried.
Okay.
Occasionally, it could be that the pregnancy is in the wrong place, in the tube, what we call ectopic.
Okay.
That would also cause a bit of abnormal bleeding in early pregnancy.
Okay.
So she needs to get back to the hospital. She'll need a detailed scan to see what's going on,
To see what's going on.
plus or minus some hormonal tests to be sure.
Yes. Okay, great. We have another caller. Hello.
Good morning.
Good morning, sir. What's your name, please?
My name is Albert.
Okay. Albert, where are you calling from?
I'm a China.
Okay, great. Albert, please go ahead.
Yeah, please, my wife had an ectopic
Okay.
because right now we've tried to have babies. So I want to find out what the problem is.
Okay, Albert, thank you so much for calling. You'll be answered.
Good. So in the case of the ectopic, what happens is that the pregnancy, instead of growing inside the womb, that becomes ectopic.
Good morning to you. It's so nice to see you. It's fun greeting you. Here we are. Good morning, and we'll see you.
Cut off like that, but sometimes certain things happen back here and we have to fix it quickly so that we can get back to you. So welcome back. We are still talking about infertility with Dr. Sefogah, and the last caller we had was
Talking about the ectopic.
ectopic pregnancy.
So in the
yes.
ectopic, the pregnancy is growing in the tube instead of growing inside the womb. And so after it grows up to a point, the tube is not thick enough to contain a growing baby.
Right.
So most of the time, the tube bursts with the pregnancy.
Oh, it does.
And then it bursts and the woman is bleeding into her abdomen.
Oh, yes.
And that woman needs emergency surgery to
Hello.
go and cut off the tube to
Okay.
save her life.
To save her life. Okay, we have a caller. This is our last caller. Hello.
Hello.
Good morning.
Morning.
What's your name and where are you calling from, please?
I'm calling for Dodowa.
Okay, your name?
My name is
Your name is?
Deborah.
Auntie Deborah, please go on.
I'm pregnant almost 4 years now. So my pregnancy since then I went to the DNC. My pregnancy is not coming anymore.
Okay, Deborah, Thank you for sharing that with us. Okay, so stay tuned and keep watching. Doctor will answer you. Okay?
Okay.
Thank you.
Yeah, so to quickly finish the egg topic. So when that happens, we need to do emergency surgery to stop the bleeding and then remove the damaged tube.
Yeah.
So every woman has 2 tubes.
2 tubes.
So anytime you ovulate from here, the egg passes through that tube. Next you ovulate from here, it passes through here. So if for the sake of the egg topic, we've had 1 tube removed, you have the chance of getting pregnant nearly reduced to half.
Because there's only one
Because
tube
there's
now.
only 1 tube.
Okay.
Okay. Just a matter of time. If the woman's age or issues are such that it is keeping too long, then we may have to consider the use of some form of medication where we give you medication or injections to ovulate from both sides to boost the chances of fertilization, and pregnancy.
Okay.
Or we have to do what we call the intrauterine insemination. Get the eggs ready, then we put the sperms right there to just fertilize the egg.
Okay, so that's the IVF.
Yeah, that's IUI.
IUI. Okay, that's
different from IVF. In IVF, what we do is that
you fertilize the egg and the sperm.
yes, we give you a bit more of the injections, so you develop so many eggs at the same time. Then we take out the eggs. It doesn't involve surgery.
Okay.
We just put in the specialized cam through the vagina. It takes us to the eggs, take out the eggs, and then fertilize them in the special laboratory.
Okay.
So we form the pregnancies, and then they grow for a few days, and we select the best and put back inside the womb.
Okay,
So
okay.
that's the IVF.
That's the IVF.
Yeah.
Okay. The phone lines are still buzzing and people are really calling in. Yes, please call, bring your calls in. So we will pick a lot more calls. I thought we didn't have time, but so Deborah's question. Deborah, what was your question?
Yes, Deborah says she's been pregnant.
She's been pregnant for 4 years. That's incredible, Deborah.
Yeah.
Okay.
You know, so there's a condition we call pseudocyesis, where psychologically the woman has been yearning for pregnancy for so long that it's become
okay. Let's halt Deborah and pick another call.
Right.
Okay. Hello.
Hello. Good morning.
Good morning, sir.
Hello. Good morning.
Yes, please. What's your name and where are you calling from, please?
My name is Alhaji and I'm calling from Nima.
Great. Please go on.
And about 5 years now,
Okay.
the flow of my semen and
Two of your.
the flow of my sperm has reduced.
Okay.
And before, if I had intercourse with my wife, I get good flow of my sperm. About 5 years now, has reduced.
Okay.
Automatically, I don't know the cause.
Okay. Okay. All right. So please keep watching. Doctor will answer you shortly. Okay. Thank you for calling. Okay. So let's finish with Deborah.
So somebody is so yearning for pregnancy for so long that it becomes a psychological disorder.
Okay.
Where they think they are pregnant.
But they are not.
They are not. Okay. And so because they have fed that information so much to the brain begins to give you symptoms as if you're pregnant. You get your morning sickness, you feel nauseous, and then you feel as if your tummy is bloating. And the body responds in that direction.
Wow.
So they are people who typically may say that
They've
I've
been
been
pregnant
for this number of years. Occasionally, some people have fibroids that have grown so big.
Okay.
Okay. Fibroids can be as big as the size of a baby. The fibroid we removed yesterday was about a woman who was 8 months pregnant.
That's serious.
So it's been fibrous, she's been carrying all along.
All along.
And so somebody like that might think that it is pregnancy. And they say somebody doesn't want me to deliver, so the pregnancy is there.
Okay.
So Deborah needs to get to see the gynecologist.
Okay.
We'll do a scan, we'll examine her, figure out what exactly the problem is. And we'll
Okay,
solve
I was
it
going
for
to
her.
say that shouldn't you have scans when you're pregnant so that you see that you're not pregnant?
Exactly.
Yeah.
So
okay.
she needs to get seen and then get a scan done.
Okay, so let's talk about
yes, Alhaji from
Nima. Yeah.
Yeah, he says that for some time now he thinks that the flow of the sperm has reduced. It's a shame we didn't get his age, but it could be something related to the age.
Okay.
Maybe the production of the sperm has gone down, or maybe he's beginning to have problems with the prostate.
Okay.
Yes. So you definitely need to get seen. Get to the hospital, let a specialist see you, would examine, do some labs, do a scan, examine your prostate, and then check to see if there's anything wrong with the testes. And then there should be a way of helping you.
Okay, okay, that's great. I don't know if we have any more callers on the line. Okay, there's a caller. Hello. Hello. Oh wow. When you call, please lower the volume of your set so that we can hear you. Okay. Hello. Okay, I believe we've lost our caller, but so can. Oh my goodness. Hello. Hello.
Yeah, my name is Mercy.
Okay. Hello, Nancy. Good morning.
Good morning.
Where are you calling from, please?
Princess.
Okay. Please go on.
A friend told me that when you are heavy, you need to give birth early because at the age of 30 going, you find it very difficult to give birth. I want to know how true
How
it
true
is.
that is. Okay, so hold on. Don't go. Let doctor answer you that right now.
All right.
At the age of 30, if you are
Yes,
hairy.
Yeah. So, not necessarily if you are, did she say heavy or hairy?
I believe she said hairy.
Okay, I mean, basically, the hairy may have to do with the polycystic ovaries.
You said
so
that,
that
yeah.
if you have that and there is difficulty conceiving, you need help for us to help you to get pregnant. But generally, for every woman, we encourage you as much as possible. You should finish having your babies before or by age 35.
Okay.
The reason is from age 35, the air quality has become a
Lower.
little poor, right, than it used to be when you were in your 20s. And then beyond that, there's a risk of having babies that could come abnormal. For example, the commonest is what we call the Down syndrome, or pregnancies after 35. Then there's a risk, slightly higher risk, of having issues with repeated miscarriages or pregnancies that will be complicated with high blood pressure or diabetes or stuff like that.
Okay. Okay. So I just had a question from my producer, Nalamli. Nalamli, doctor says the cutoff point. Okay, not necessarily the cutoff point, but by age 35, as much as possible, you should be done birthing. But she wants to know that when is the appropriate age to get pregnant?
Oh, right. Okay. So the woman's eggs are of the best quality between the ages of 20 to 30.
Between 20 to 30.
Right. But of course, you can't prescribe the fixed rule for everybody. So we say it is best to not delay conception till after 35.
But we still do have people who,
of course, who are very normal
after 35.
Yes.
Yeah.
Just that the chances of something going wrong are slightly higher after age 35.
Okay. We talked a little bit about IVF and
Yes. So then the reason why sometimes they get multiple pregnant during IVF is because when we fertilize the eggs, in order to increase the chances of success, we put in
more than one egg.
More than one, maybe two or sometimes even three.
Oh, okay.
Just hoping that at least one would implant.
Right.
So in a few times, both would implant.
Okay.
Occasionally, all three would implant. And that is how come. Sometimes you put in just two, and one of them would further divide inside.
Oh, okay.
So that's
then you
why
have triplets.
It's not a deliberate thing to have multiple. But it's the procedure that comes with that.
Okay. Anyway, we'll still take that as a blessing.
As a blessing. Yeah.
Anyway, we have really hard pressed for time. I wanted to talk about surrogacy, but just give us your phone lines where we can reach you, where your contact, you're located, and all that.
So I mean, Shape Healthcare is near Kolibu at Latibia Okoshi.
Right.
And the front desk is 0302 631880. 0302-631880.
And there's another number here, 054-926-2100. 054-926-2100. Okay, and then there's yet another one that you can, I believe you can WhatsApp or text. Is
054 is
okay, and then 020-6301-297. 020-6301-297. So any of these numbers, you can get Shape Healthcare and speak to Dr. Promise E. Sefogah. Okay, all right. It's been fun and interesting. And you do surrogacy.
Yeah, we do surrogacy.
Okay,
basically, what that entails is getting somebody
to carry your
pregnancy for you, or if for some reason your age wouldn't make it possible for us to use your own eggs, we have an egg donor whose egg you would agree to use for your pregnancy.
Okay, I believe we will talk about that in detail some other time. Right. Okay, all right. Thank you so much for being here. It's been delightful. Thank you so much.
Thank you for having me.
You're always welcome here. Okay, and thank you so much for tuning in and watching till this time. Okay, thank you so much. We've been talking to Dr. Sefogah about infertility, and we had so many calls. We had so many revelations here about a lot of things that even I didn't know. So thank you so much for watching. I hope you learned as much as I did. Up next is Bemain with In Focus. So do not go anywhere. We'll be back.
Good morning to you. It's so nice to see you. It's fun